So the reason we put this together was just to kind of give healthcare providers a glimpse into what it might feel like to be the person that's living with the diagnosis and having to overcome some of the symptoms, obstacles, frustrations, maybe even fears to discuss what's happening, or even things that are prescribed to them, what it might be like to experience something like dysphagia and, to be prescribed Thicket, to help them swallow safely. Sounds great in theory, but if you've never actually tasted it and swallowed it, especially somebody who might be more sensitive to textures, it can be really challenging. So we wanted to kind of give them an opportunity to step into that world. They obviously understand it from the, expert side of things, but we really, besides teaching people about therapeutics, we also really try to infuse the patient voice into ATMRD and just give that experiential opportunity through something like this to kind of experience that feeling and to build empathy in that. I think most people care very much and they're very compassionate, but to actually have to step in and experience some of these things, so we have different activities throughout this empathy and action session. So we start off even in the morning with breakfast, and there's some things that they're going to be doing while they're eating that might be sort of a way to experience what it might be like to have certain symptoms. And then after the breakfast, we have different stations. And so they're going to be experiencing things related to rigidity and motor changes, to swallowing, which I kind of gave away, articulation. We have some of our patient ambassadors that are here, part of our PMD ambassador program, actually running role play scenarios. And so they're going to be serving as the healthcare provider, and the attendee is going to sit in the role as the patient. And they're going to be given sort of a very brief, this is your scenario. You are a 68-year-old female diagnosed with this condition. You came in today feeling these feelings, and go. And we give them like prompts, and they have to actually experience trying to tell their physician, their healthcare provider, what they're there for, what's the problem, and then receive sort of maybe a less compassionate or empathic a response, like, okay, just do this, here's a prescription, or whatever the case may be for that scenario. And then a different experience of very caring, very compassionate, just kind of leaning in and understanding and asking, more open-ended questions, more probing questions, and giving that patient an opportunity to describe what is actually going on and what that dialogue might actually uncover, and then ask them what it's like to have heard it from both scenarios, and give them an opportunity to see, like, maybe even just the way someone reframes something, or the way they ask, or just the way that they respond to the patient, how that might impact the patient and what they actually are willing to disclose. Last year at ATMRD, we did a survey and had a session on what we called lip sealed, what patients aren't telling their providers. This sort of goes along with that, because sometimes they don't tell things because they're embarrassed or they're fearful. Those were like some of the top reasons people weren't disclosing really important symptoms that could be treated, but either they didn't know it was a symptom and they were embarrassed about it, or they were fearful that they were going to look weak to their healthcare provider, or they were afraid what that might mean for the trajectory of their disease, or what kind of treatments that they might have to continue to add to what they're already doing. And so this sort of kind of goes again, to support that, to take it to the next step of like, okay, so we know that people aren't necessarily disclosing things. We know people are struggling with some of these symptoms. So step into their world and, experience as much as we can and these little stations to see what it might be like and kind of help with that dialogue. It's really just something that we feel very passionate about.